and Treasurer Dr. Rajendran for giving me this wonderful opportunity to be a moderator of this session. And as the district office bearers this year, we were not able to conduct regular CM programs, but our state IAP has done a wonderful job of organizing these regular webinars. And thank you all for that, sir. You have really compensated for our shortcomings. And now the next session, this session is going to be very useful for all the practicing pediatricians, especially for the younger ones who are planning to start a pediatric clinic. And not only for them, like even for us, we can update ourselves. And about the speaker, of course, he doesn't need any introduction, and he is well known to all the pediatricians all over the state. He has been giving regular lectures on various topics, and he has always got a practical approach, and his lectures have always been very useful. And Dr. Palaniraman, anyway, he is practicing as a consultant at Dindivanam for the past 26 years. He is academically active, trying for excellence in office practice. And he has won the national level practicing pediatrician quiz in 2002 at Pedicon, Bangalore. And his areas of special interest are infections, hematology, and computers. And his future vision is to do serious research in office practice next 5 years, which in turn will benefit our nation's pediatric problem, this thing. And he is the active propagator of rational antibiotic therapy in the state for the past 10 years. Now his lecture will be really very useful for all of us. Over to Dr. Palaniraman, please.
Am I audible? Hello?
Yes, please proceed. Welcome.
1 minute. Desktop one.
Dr. Palaniraman is the executive board member of next year. He is a representative from Tamil Nadu next year.
My screen is visible? Is my screen visible now?
Yes, please. Yes.
Yes. Thanks, Dr. Sendamarai, Madam, for the introduction, kind introduction. First of all, I thank the State Office Bearers, President Sendil, Suresh Balans, and Rajendran, as well as our Vice President Nagaraju, and past presidents, incoming president, and finally the captain of our Smart Clinic project, Dr. Sunil Srinivasan, for giving the opportunity and taking this project at the national level. So far, we were talking for the past nearly 7 months at various areas of corners of India. So now we have come to our homeland. At least first we should be a model in a Tamil Nadu state. We should be a model as a smart clinic. We should try to upgrade our clinic to a smart clinic in all the clinics. So let me start my lecture. The thing is mainly the essential gadgets, which is a very essential for day-to-day practice. Disclaimer, no conflict of interest with any firm. With whatever I'm showing the specific companies, I'm not having any conflict of interest. Introduction, updating your knowledge matters most. Definitely, we have updated with our central DIP platform with very good knowledgeable. We have, for the past 6 months, our knowledge has been doubled, tripled so much, so that now everything we have from the January onwards, we should be put into practice our knowledge. For that, our upgrading our clinic to smart clinic also do matter. Let me outline how the essential gadgets will improve you to how to upgrade your clinic, the picture gallery of the thing, and cost and availability, and take home messages and thing. To start with, I am going to mainly the essential gadget which we are going to discuss. To start with, it can be a diagnostic instruments in the form of starting from stethoscope to otoscope, all the scopes. Then the vital monitoring, which are very essential, starting from the thermometer to BP apparatus, pulse ox, glucometer, and everything. And we as a pediatrician are very much concerned with the growth of the child. So all the scales are very important, starting from weighing scale, infantometer, stadiometer, and whatnot. Finally, going to the therapeutic aspects, we need a resuscitation kit, and which is a very essential, particularly in this medico-legal area. And we are vaccinating plenty of kids. Very rarely we can come across any problem. So definitely we need the basic oxygen airway devices and resuscitation kit. And finally, our breadwinner, the immunization. So we need a basic vaccine refrigerator, which I will talk in the thing. And finally, the electronic record keeping, the IAP software, how far it is very useful in day-to-day practice. Okay. Okay. To start with, as a thing, the stethoscope is the prime thing for any physician as such. We all from our postgraduate days are very fond of the Littmann, from undergraduate from the Littmann brand. So we used to use the classic 2 pediatric stethoscope is the basic thing, which is very, very useful for the regular practice for any pediatrician. Definitely, no doubt about it. Coming to classic 3 model, for example, some people like Sendil or Vijayarani, or some people are mainly adolescent practice oriented. They can go for this classic 3 stethoscope because it has an adult diaphragm and pediatric diaphragm. They can go for this classic 3 model. And some people like Tirumurugan are mainly having neonatal practice, and with extended infant practice, they can go for this infant model, classic 2 infant model, which is a very small diaphragm, which will be very sensitive for the neonates. And if you are in a research, you can go for the Littmann electronic model, which I have bought, but because of the heavy thing, it is very difficult to use in day-to-day practice. And I don't think this will be useful for day-to-day practice. Coming to the acoustic performance of the various Littmanns, the lightweight thing which we won't use, the classic models are the models, classic 2, classic 3, infant and everything which we are using. It has a score of 7 to 8. Compared to the cardiologist with around 9 to 10, electronic 10. These are the acoustic parameters. So all the regular Littmann will have around 7 to 8 is the score of this stethoscopes with respect to the sensitivity and the performance. Okay. So are there any other brands available in the market which are very useful for day-to-day practice? I really was in search of many brands. About 10 years back, I found out the Welsh line Harvey Elite, which is a very good model, and which it mainly the sensitivity comes at around the score of 9. It is definitely more sensitive than the regular Littmann. I found it very useful, and particularly in the babies, very difficult to auscultate. You find it very useful. Only thing is the weight of the stethoscope. Otherwise, it is a very fantastic Harvey Elite model from Welsh line. The cost is around just 12.5K. It is around 4K extra than the Littmann. Next, coming to the other well-aligned models, that these are not useful. One is the basic model, not useful. Another is the very heavyweight model like triple bed stethoscope, not much useful. Next, going to the baby-friendly stethoscope, the American Diagnostic Corporation, another market leader in the instruments, they have come out with a baby-friendly. Particularly, the bell has been replaced with the animal heads, and which is very baby-friendly. It's has a sensitive diaphragm too. And this is also it also equal in cost like our Littmann itself. You can go for this ad scope also. Okay. Next, what is the final thing in the basket? Now, this is the thing, Stethi Pro. It has been devised by an Australian physician around 2-3 years back. It has been 2018. It was introduced, and it was FDA cleared to, and recently available in the market from October 2020. It is available in the market. The Stethi Pro is nothing but it has just a diaphragm, and you can easily it's a tubeless stethoscope. And this thing has been completely, all the signal has been through the Bluetooth, has been transmitted to the smartphone, and all the things has been recorded and shared, one thing. Or you can, as such, what you can do, it can listen, see and feel. It is so simple. And you can otherwise also, it can be used as a wired stethoscope with any of the headphones you use. You can insert, and finally you can use as a wired stethoscope also, as well as you can use it as a wireless with the Bluetooth and the Bluetooth earphones. You can use as a wireless stethoscope also. What are the main advantages? When you are connected to the Stethi Pro app in the smartphone, the best thing is it gives both the heart rate, the diastole, systole, respiratory rate and whatnot. It's even the respiratory rate comes. So that is the advantage, and you can share this thing for the further, and it can record this thing. This is the Stethi Pro app. The only problem is the cost. You can see here the heart rate, the respiratory rate, average systole, average diastole. That is the advantages of this Stethi Pro, which is mainly it works on artificial intelligence. The only thing is the cost. Even it is available in India now. The only thing it costs around only $600, $500 to $600. Coming to the verdict, what is the best suited for our day-to-day practice? When it comes to day-to-day practice, Classic 2 is the best, or you can go for ADC, ad scope. That is the number 2. That is the two things. Okay, well, coming to the COVID stethoscope, during this COVID period, plenty of stethoscope have been coming into the market because of the non-contact stethoscope. These are all non-contact stethoscopes with the help using the help of a Bluetooth. The stethoscope is like a toy. Don't go for it. It is like a toy. It is not at all a stethoscope. Then going for the EcoCore digital stethoscope, which has been used extensively in the American market. All the people used it, and it is a highly calibrated, FDA approved, and this is the Bluetooth module. And with the help of this module, everything is transmitted through a smartphone, and from the smartphone, you can hear, for example, patient can be in the next room and he can use this can be separated, and the diaphragm can be in the patient head, and with the help of the smartphone, you can hear it. So you can see this is the smart diaphragm. This is the module, smartphone, and your earphone. You can definitely use it even when you are in the next room. The competitor is the ThinkLab one, but this is the thing here. You can see how the patient is using, and you are in the next with the window separating you, the glass window separating you. You are sitting in the next opposite room, and you are able to auscultate. This is the thing. Is comparing all the three digital models, which is the best. EcoCore is the best. Coming to the other, compared to them, all the things cost around 20 to 25,000 rupees, and these things. And now, for example, because of the COVID and courier problems, we are not able to get it. Now another one thing has come, which very recently from in the month of October, and this is the one which I want to mainly stress upon. When you want to go for a digital stethoscope, don't go for electronic Littmann electronic 3200, which costs around 40 to 50,000. I had spent on it, but it is not useful. Now, this is the latest Littmann company as well as the EcoCore. They joined together as a joint venture. They have come. The diaphragm is a cardiology grade with a quality of 9/10 and up to 40 times amplification. For example, small babies, when you are not able to hear, or obese individuals, you can switch on this button and amplify the sounds and hear very well. An active noise cancellation is there, and two modes are there. You can use it as a simple analog stethoscope or a digital stethoscope, both adult and pediatric. It has both heads, like an adult cardiology diaphragm and pediatric head is there, soft sealing ear tips. This is the final thing available in the market, comes around $350, roughly around 25,000 rupees. Anybody coming from US, you can ask them to purchase and come. This is the latest with respect to advanced stethoscope available in the market. So this you can see with the pediatric head, you are able to auscultate very nice with a new class of clarity. This is the final thing. Anybody who wants to go for the ultimate thing, this is the ultimate thing available in the market for 25,000 rupees now. Okay. Take listening to a new level. Okay, you can think. Okay. So far I have talked about stethoscope, the basic Littmann you can go, or advanced Littmann you can go. Okay, coming to the next set of scopes, the otoscope is very, very essential for a pediatrician. No day is passed without an incessant cry or a fever without focus. In an incessant cry without seeing the ear, you can't diagnose otitis media. In the same way, in a fever without focus, sometimes focus may be sitting in the ear, you will be missing it. So based on the voltage, whether 3.5 volt or 2.5 volt, based on the LED or halogen model, the price varies. You should go for 3-point voltage model. Why? Because high power is very, very essential, because in the pediatric, you are using a small specula. The brightness is very important. So you should go for a 3.5 volt, number one. You should go for a LED bulb rather than a halogen bulb. These are the two essential things. These are all basic models with the 2.5 LED models coming around 7.5 to 8,000. This is in the same way, ophthalmoscope is also available with the same model, like a 2.5 volt. The basic things are available. Now, this is also very essential because of the headache is a very common problem. Every week, at least 1 or 2 headaches will be coming. You have to see the fundus. Without fundus examination, you can't confidently say the child is all right. So ophthalmoscope is also a must for any pediatrician. Obesity is also another thing where we have to examine the fundus. And so the final thing which I really suggest is the Riester is another German make. Compared to the Welsh line, this Riester LED 3.7 volt otoscope and ophthalmoscope are available for 12 to 14K. This is the distributor available. This is for a basic person to start with. This is a wonderful model to start with, LED 3.5 volt otoscope and ophthalmoscope. What is the best in the gallery? This is the macro-view otoscope with throat millimeter by Welch-Allyn. It magnifies the tympanic membrane 2.5 times. This is the thing which I am using for the past 10 years. And it's really a wonderful otoscope. And I have no words to express. Once you see the tympanic membrane with this, you will never go for the inferior models. And you can't go for the endoscope in which ENT surgeons use. It is only useful only about 2 years. So we have to go for a macro-view otoscope. This is a very useful model. Only thing is the cost. It comes around 25 to 30,000. That is the only thing is the problem. So coming to the wax removal, the basic thing is the international standard is the bionics wax removal, which is not available. These wax removal curettes are available in Indian market. Okay. Coming to the throat examination, every day you come across the fever, you have to examine the throat properly. Gone are the days with the everyday torch and halogen with the yellow light, and are the cheaper available LED light with the blue lights. You have to go for the standard LED white light, bright white light. So for that, what is the available thing in the market? Particularly the Welch-Allyn throat illuminator is very useful. It really illuminates the throat like fantastically. And these are the cheaper models. This comes around 5,000, which comes from the brand Heen, a German company. This is a throat illuminator by ADC. It is only for throat illumination. The cost is very enormous. It comes around 30,000 to 35,000 only for throat illumination. This is from the American Diagnostic Corporation. So finally, the best model will be that this is the best model which can be used both for otoscope, and this unit can be used for mainly throat illumination. Both the throat illumination otoscope combined you have only for 30,000. This is the best thing which I advise mainly for you people to go for. So, and ultimate, what is the ultimate thing with respect to all the scopes, particularly the examination of the ear, nose, throat? The best thing is go for the Welch-Allyn wall unit. The latest is 777 model, and no hazards of recharging issues and the brightness issues. You can examine fantastically with the help of the macro view and coaxial ophthalmoscope. The cost, it is available in India itself. All the Welch-Allyn, the cost in India is cheaper than the US. No need to ask them to buy from US. You can available in the India itself. The price is cheaper rather than the US. That comes around 45,000. Okay, going for the scopes to the tongue depressor, the wooden disposable tongue depressor is the best thing. Next is the pen light. We need for the pupil, simple pen torch is enough. Then going for the next, the vital signs monitoring. So now the mercury has been replaced. Now no longer is the world of mercury thermometer or mercury manometers. You have to go for the non-mercury aneroid sphygmomanometer. So better go for a validated, internationally validated models like a Riester, a German make, or a Heen, a German make, or a Welch-Allyn, which is also German make. All the models comes around 5,000, which are very much validated aneroid sphygmomanometer, and the cuffs are available in all the sizes. Everything is available in India in the Amazon itself, or I dedicated distributors I am giving in the end. And when you want to go for a NIBP apparatus, this is a NIBP monitor by Riester, German company. It is a home for a home purpose, but as a pediatrician, this is more than enough, because you will be hardly seeing 1 or 2 BPs per day for an obese individual or a headache children. So definitely a good BP apparatus in the form of NIBP for 6,000 is available. You can go for it. This is available. And in the same way, NIBP for the home series by Welch-Allyn is also going to be available by the early February. It will be available for around 6 to 8K. This is more than enough. But if you are running a women and child health center, if you want a very good BP apparatus, hospital grade machine, you have to go for Pro BP 2400 model, which costs around 20K, or the ultimate one is the 3400 model. The advantages of this thing is when you are inflating the cuff, you will get the BP. That is the specialty of the, when you are inflating in a few seconds, you can get the BP. This is a NIBP from Welch-Allyn, which all the cuffs are available. The cost comes around 35 to 40,000. This is the one I am using from 2012. It is really so far no hassles. It's a one-time purchase. It is a lifetime purchase. Going to the thermometers, gone are the mercury thermometers out. Now simple digital thermometer will do for a pediatrician. No need to invest in costly thermometer. We pediatrician never care about the temperature. We see the sickness of the baby rather than the temperature of the baby. So no point in going for high price that is infrared thermometers like a contact, non-contact thermometer. These are only like a show masters. No need as a pediatrician. But here I want to mention This is one thing like a temp touch, which costs around 1,500. It's very in 6 seconds. You can see just with a touch of in the temple region, you can get the temperature just in 6 seconds, which is FDA validated. American, but it is not available in India. Soon it will be available. It is available in desert cart for a people cost of around 2,000 rupees. This is very useful. And these things I don't suggest. And finally, what the up-to-date suggests is all the contact infrared and non-infrared temperature thermometers are inferior to the digital thermometer. They are inferior with respect to evidence base. The NICE guideline also suggests go for a best axillary thermometry with a simple electronic thermometer in the axilla. That is more than enough. So coming to the axillary digital thermometer, and this is a very important thing is here, for example, regular digital thermometers will take roughly around 1 to 2 minutes. So you can go for a rapid measurement of the digital thermometers, which measure in 8 to 10 seconds. This is one thing which is available in India itself. The cost is around 1.5K, because this is FDA approved. This can be used orally in the axilla, in the rectum, for all purpose. This can be used. This is a Kinsa thermometer available for and a rapid digital measuring thermometer. The another brand is ADC rapid thermometer, but it is not available. So these are the two brands of rapidly measuring digital thermometer. Either you can go for a cheaper 200 rupees digital thermometer or a 2,000 rupees digital thermometer. It's your choice. So going from the thermometer, what about the pulse oximeter? This is a very, very essential. It has become an essential from the COVID days onwards. But plenty of pulse oximeter is available in the market, which to buy. But all the common things available, 2,000, 3,000 rupees, don't go for it. They may be very useful in a healthy individual. In a sick individual, when there is low perfusion, when there are a movement like in pediatric age group, you should go for a hospital grade pulse oximeter with a good international standard Massimo technology or Nelcar technology or Oxytip technology. 3 technologies are available in international. This is the Massimo technology is one which is easily available. This is a ISPO2 Massimo. This is the module. This is you can attach to our iPhone or an Android phone, and this is the fingertip sensor. So you can easily connect, and you can see with the help of the smartphone itself, the price comes around 16,000. It is easily available in Indian market. This is a fantastic one for regular office practice use. Next, so this compared to the other regular pulse oximeter, this is the hospital grade. It shows that you can see the difference compared to the other thing. And ISPO2 results, you can see the perfusion index, the temperature, the pulse rate, as well as with the thing. What about the simple things available in the market? These are all the hospital grade, which is not available. These are brands available in the US market. No need to worry about it. So only thing is you can go either for ISPO2. If you don't want a smartphone to be used, if you want a exclusive handheld Massimo, that is Massimo grade pulse oximeter, this is one which is available for 25K. And you can go for a pediatric fingertip oximeter, fingertip sensor. It can be used from a newborn to an adolescent. This is the advantage. And they say from 10 to 50 kg, but even in a newborn for cyanotic screening, this can be used. So this is very useful. Next, there are 2 types of sensor are available. This is the one which I have told, that is from 10 to 50 kg pediatric digital sensor. For office practice, this is more than enough. If you are a neonatologist, you can go for multi-site sensor. More than 1 kg for preterm babies to adults, it can be used. These are the 2 types of sensors available, and one is available free along with the module. Other one is available costing around 5,000. Now, what is the latest in the Massimo technology? This is the one which is the latest, comes around 50,000 rupees. The best advantages is it shows the pulse oximeter, that is pulse ox is shown, the temperature is shown, respiratory rate is shown. This is has been validated. Even Indian setup itself in Lady Harding Medical in Delhi, it has been validated in the August. It is available since October. It is available in the market. It is the advantages is we are very lazy to measure the respiratory rate. When you actually place the fingertip sensor, it even gives the respiratory rate. So that is the advantage of thing. If you are affordable, go for this. Both the pulse ox, both the respiratory rate, both the heart rate, everything is available in this. Oxygen level, pulse rate, and breathe per minute, everything is available. This is a very universal sensor for most patients from infant to adult. The sensor is universal. This is very useful. It has been completely used for research in the African countries, and mainly it has been funded extensively by the Melinda Gates Foundation. And along with the hemoglobin also available, this is very costly, RAD 67 model. Okay. What are the other things in the market? This is a Nelcar model, but which is a handheld model, cost around 45,000. So far I have told what is the verdict. The simple ISPO2 handheld smartphone model costs around 16,000. Second thing, 25,000, another model. The third thing you can go for, if at all, for the pulse rate, respiratory rate, and the 50,000. These are the three things, good things, which is available for office practitioners. And another one interesting thing available nowadays, which is available in the US market, but not allowed in India because of the other restrictions, is point of care ultrasound. Just 1.5 lakhs for any specifically any swelling in the thing, you to know whether there is purulent secretion, whether there is a suppuration, whether there is a pleural effusion. It can be used as a point of care ultrasound for primary care. This is a butterfly IQ ultrasound, which is a championing new era of healthcare. It is available for the past 1.5 years, but for around 1.5 lakhs, it has not been allowed. But future will be this, instead of the stethoscope, we will be having this point of care ultrasound in our clinic. So that is the way ahead. The future will be, that is the thing. Then what about other thing? Glucometer is a very essential thing. Any lethargic baby you need to see, or any seizures we need to see, glucometer is essential. Then another one good thing is millimeter is coming. Like, because now we have a subcutaneous bilirubin, which is very costly, more than a lakh. Like a glucometer, a millimeter is coming. It is in the phase 3 trials, which will be available in the next year. Like a simple, like a strip in a glucose strip, you see the bilirubin value for the newborns. So it will be very useful in the future. This is watch out for the availability of millimeter in the future. Like a glucometer, for 10,000, it will be available. Next, coming to the scales, go for the validated scale. Don't go for the cheaper scales. Go for the Sekka, is a German brand used internationally throughout the world. Whether you go for Singapore, whether you go for Dubai, everywhere this is available. Go for the infantometer, weighing scale. And these are Indian infantometer available for 1/10 of the cost, as because the other thing is 15,000. Indian infantometer is only 3,000. It's available in Amazon. And measuring tape, head circumference tape, cost around 600 rupees. Definitely we can go for it. And stadiometer, Indian stadiometer available for 2,000. This is a Sekka stadiometer available for 10,000 to 15,000. This is a Sekka stadiometer. And finally, these are the final, coming to the final stage. These are the, for our vision checkup is very essential. Any 3 to 5 years, we should definitely go for the Snellen chart, modified Snellen chart, mainly for the strabismus. For the this technique, we need mainly the occluder. This is the one thing available easily thing. And a spot vision screener from Welchline, but the cost is very high. If you have an ophthalmology wife, you can go for it, because without the cooperation of the babies, the strabismus and the red reflex and the refraction, everything can be measured without the cooperation of the baby, which is very helpful. It's just around 3.5 lakhs. If you are having a ophthalmology wife, you can go for it. So finally, there is an X-ray view box, and no longer the stainless steel box or a wooden box. We have to go for the digital box, which we can increase the illumination or decrease the illumination. Just 10,000, we can go for this digital illumination. And the basic resuscitation kit, everything is available just for 3 to 5K. And finally, the vein finder for emergency vein thing, and very costly things are available in the US market. For Indian market, just 2,500 to 3,000. Vein finder, LED vein finder is available in Indian market. So these are the things. Coming to the bread and butter of us, that is the vaccine refrigerators. Now, standing instead of the ILR refrigerators, which were used long back, instead of the regular refrigerator for using us, because our learning now, it has become very, very based on our vaccination. So we need to mainly concentrate on our vaccination with a proper refrigerator. This is a Godrej vaccine refrigerator. It is a WHO pre-qualified, available in India itself now. And the best part of this thing, this is the one which I have bought, and this is the inside thing. And the best part is the precise 4 degrees is maintained from top to bottom. And even without electricity, 3 days it can maintain the temperature. And the data is available for the past 1 week. You can get the data also, how much the temperature was maintained. This is a very useful thing. So this is the latest available for 80,000 to 90,000. This is the cost available in the market. So these are the essential gadgets continue so far, starting from the diagnostic equipments, from the scopes to the vitals monitoring, to the all the things, and finally the things. essential gadgets. This is my office with all the essential things I'm having in my office. This is the Welch line with all the wall unit. This is the 767 model with all the stethoscopes, which I have experimented with all the stethoscopes because of my passion for the gadgets. This is my clinic entry. Just I'll show the outline. This is my reception, the entry of the clinic. The patient comes, gets registered in the computer. The patient is getting registered. This is the waiting hall reception. These are the display boards. This is a standard SA machine of weighing apparatus. The previous stadiometer made of wood. And this is the another weighing scale of Burer weighing scale for standing babies. When I go inside, you can see this is the Welch Align Pro BP model. This I am using for the past 8 years. Littmann. This is the Kinsa thermometer. It's a rapid 6 seconds thermometer. IAP software. This is the pen light. All the specula of the otoscope, Seca head circumference tape.
Time's up.
You can see the laser printer, and this is the X-ray viewfinder. You can see the Welch Align charger. This is the throat illuminator from the Welch Align. And this is the ISPO2, which I was talking about, ISPO2. This is a Welch Align Harvey light stethoscope. This is the otoscope, that is macro view otoscope, which is very useful for everyday practice. This is my bedside microscope. This is a Seca stadiometer from Seca, just around 10,000 when I bought. It's an emergency drug kit. And this is again a weighing machine, which I am having inside also to counter check because our weight, some people may not be properly weighed. So counter check infantometer from Seca. And this is the Godrej vaccine refrigerator. So this is the final thing. Okay. So everything I have used, and I am giving my own experience, how I am using for the past few years because of my passion for the gadgets. Because definitely they make a difference when a patient comes to your clinic compared to the other clinic. They see, particularly the patients from abroad, as well as the patients, they see the difference, how you are examining, how you are thinking. And when you are seeing more than hundreds of patients, you need to examine in a short period of time with the very best results. You have to bring it out from the examination. So these gadgets are very useful to pick out the findings, and in the long run, they definitely makes a lot of value for the thing. What about the final cost, sir? Thousands of how can I purchase? When Padana clinic, how I am going to purchase? What is the final cost? When you go
Dr.
for the
Palaniraman, time's up.
Last slide, sir. Last slide. The smart clinic, the basic cost is around 75,000 to 1 lakh only. When you go for the smart Allied clinic, little advanced equipment, it comes around 2 lakhs only. When you go for the full-fledged smart Allied clinic for the including the vaccine refrigerator software and everything comes around 5 lakhs only. We spend a lot for all the things like a car and everything, flats, everything, thousands, the crores salo pandro. But this 5 lakhs, when you put as a loan, definitely it will be useful for improving our quality care and making it as a clinic, smart clinic. It's not the cost, only the attitude for the excellence in your practice that matters. Everyone, I want at least the smart clinic, basically for the beginners, 1 lakh you can spend. For the other, in the intermediate level, you can spend 2 lakhs. And for the other who have already go for the 5 lakhs. I have given all the resources available, who are the distributors, everything. You can take a screenshot of this. Definitely all the distributors where are the phone numbers also I have given. And thank you very much for the patient hearing. Any doubts, I'm ready to answer. Thank you very much.
Thank you very much, sir. And your lecture has been really wonderful and highly informative also.